gland is a gland in the neck in front of our windpipe below the Adam's apple. It is shaped like a butterfly. It's got a lobe on the right side, a lobe on the left side with a bridge of tissue connecting the two. The gland produces a hormone called thyroxine, which is necessary for metabolism. That is, it helps the cells function at the right speed. So if too much of the hormone is produced, the cells work faster, the body starts working faster. Or if too little is produced, the body slows down. There are generally two sets of disorders that can be associated with the thyroid gland. One, as I mentioned earlier, too much of the hormone can be produced, which we call an overactive thyroid, or too little, that is an underactive thyroid. These problems are generally dealt with by the GPs, or sometimes they are referred to a separate group of consultants called endocrinologists. We as thyroid surgeons get involved if there is a swelling of the thyroid gland, which we sometimes call a goiter, or if there is a nodule within the thyroid gland. And we normally recommend surgery if there are symptoms due to the size of the thyroid gland, due to increase in size, or if there is any concern that these swellings could be malignant. Most patients with thyroid cancer present with a painless lump in the region of the thyroid gland, that is below the Adam's apple, and generally in the midline, or occasionally on one side or the other of the midline. Occasionally, the thyroid cancer within the thyroid itself may be too small to be visible, and patients may present with the swelling of the lymph gland. And in that case, patients will present with a swelling on the side of the neck rather than around the midline. And then once we investigate the swelling in the lymph gland, we realize that it is actually arising from a tiny cancer within the thyroid gland. One must remember though that the majority of the thyroid lumps that are seen are benign, but we often investigate them by doing an ultrasound scan, or sometimes a test called FNAC, a small biopsy with a needle, to ensure that we don't miss an early malignancy. The most common cause of neck lumps are swollen lymph glands in the neck as a result of any minor infection or inflammation in the head and neck region. It could be a skin abrasion or a common cold. We all have hundreds of lymph glands in the neck, and they swell up as a result of any infection or inflammation. But any lump in the neck that persists for more than about 3 to 4 weeks, or any lump which is growing in size without any obvious signs of inflammation or infection, should be investigated further. Thyroid cancers are generally divided into stages. We call it T1, T2, T3 or T4 based on the size of the tumor within the thyroid gland, or whether they have spread to the surrounding structures such as muscles or nerves, the windpipe or the footpipe. We also stage them based on whether they have spread to the lymph glands in the neck or to distant sites such as lungs or bones. The most common form of thyroid cancer that we encounter, it's called papillary cancer or follicular cancer, can be effectively treated with an excellent chance of cure, and treatment generally involves surgery. Early thyroid cancers, that is T1 cancers or some T2 cancers, can be treated surgically by removing only one half of the thyroid gland, the half that is involved, and by preserving the other half. For advanced cancers of the thyroid, we recommend removal of the entire thyroid gland, called total thyroidectomy, and sometimes we also remove the lymph glands, groups of lymph glands that are involved at the same time. Patients who need removal of the entire gland, that is total thyroidectomy, often need some additional treatment in the form of radiation. But we give these patients a very targeted form of radiation called radioiodine treatment, which specifically targets thyroid cells and cancer cells and minimizes damage to the other cells of the body. operation is done under general anesthesia, we either remove one half of the thyroid gland or the entire gland based on the underlying condition. An incision is made in one of the lower neck skin creases so that the scar is hidden within the skin crease. There are a lot of important structures around the thyroid gland, many blood vessels that supply the gland, some important nerves, and we take care to carefully identify these structures. The blood vessels are all carefully identified and tied off. Special attention is given to preserve some important nerves in the neck, which are closely related to the thyroid gland. These nerves supply the voice box and make the vocal cords move. We gently separate these nerves from the gland and the gland is removed. Small drainage tubes are inserted into the neck which drain away any excess fluid after the surgery, and these tubes are generally removed after 24 to 48 hours. The wound is closed either with dissolvable stitches or sometimes with skin clips, and the scars generally heal well. In the post-operative period, patients may experience some discomfort or pain in the neck, and these can be controlled with painkillers. If the entire thyroid gland is removed, we tend to monitor the calcium levels after the surgery because there are tiny glands very close to the thyroid gland which maintain the calcium levels of the body, and these may be bruised during the procedure and the calcium levels could drop in a small percentage of patients. Once we are certain that the calcium levels are normal and once the drainage tubes are out, the patients can go home, usually 1 to 3 days after the surgery.